Jimmy, Dr. Buford. We're just getting started on the left shoulder here. We've got our shave rim. We're just smoothing out some of these rough areas so we can make a good diagnosis of everything that's going on. Here's your biceps tendon, and it has. And look at that. You've got a big loose piece of cartilage, so we're going to deal with that. Of course, we'll see how tough it is. Sometimes we can just shave them out. Sometimes we have to physically grab them and remove them. It looks like this one we're going to have to grab. But in the meantime, we'll just keep working here on the biceps. Let's look up at the rotator cuff. Here's a little tear in the rotator cuff right here. We'll place a marker stitch through there. Actually, we use a high-five stitch. Let me see the cover, please. Okay, here we have a grabber end, and we're holding on to that piece. We'll remove it cannula. If we can't split it in a couple little pieces, we'll just back the cannula out and take it out. Close on. So now we've got that piece removed. We'll go back with our shaver. Let's look down the front. I don't see much else to do now. I'm just trying to see if there's any obvious place where that piece came from. I think probably somewhere in here. This area is a little bit loose. I'll show you some more in a little bit. Okay, now we're looking from the back, or from the front to the back. This is another area where loose pieces probably have been coming off of the cartilage here. You can see there's this defect, and then there's the one we were already working on right here. That one looks like it's contained, which is actually a good thing. Although obviously neither of them are changes in the glenoid that you'd like to see. passing a spinal needle across part of the tendon that's partially torn. And here we are grabbing the relay. Okay, so here we are about to pull back, and as we do, you can see how it brings that blue and white striped suture. That looks good. We're going to pass that spinal needle one more time. Do you have any other color hi-fi suture?
White.
Huh?
White.
Okay. Second pass, we're trying to get way lateral. Take that right there. A little suspicious in the way that feels. Feels like maybe. Okay, so we are just passing the second suture. And now we've got two kind of vertical sutures here. And that will give us either kind of a ripstop stitch, or if necessary, it'll mark where the tear is so we can take it down and repair it as a full thickness tear if there's any damage on the dorsal side. So I think we're done inside the joint. We're going to keep looking around, but I think that's pretty much it for inside the joint. The main thing are these areas where there's loss of cartilage, right there and right there. So you've got some arthritic changes in the joint. Pause, please. Okay, so we're done with our bone work. We've made the acromion pretty flat here. That looks good. Put in our cautery tool here. And what we're seeing here, as we look down, we can see our sutures. And the good news is I don't see any significant tearing or injury to the rotator cuff on this side. Here's our sutures in the back. That's really back towards the infraspinatus. And then our sutures in the supraspinatus are these white sutures here. And on the surface, the cuff looks good. So I think we'll be able to tie those sutures and not have to take down the tendon or use a suture anchor, which I think will be better for you. So we'll go off on the video and show you when that's done. Okay, we're all done here. Hold this one. As we rotate the arm, we'll show you the sutures. There's the white one right there. And then in the back, we'll see the blue and white one right there. And those are both tied. They function as what we call ripstop stitches to prevent the cuff from tearing. Probably the bigger thing we did was take off the bone spur and that real tight coracoacromial ligament, and that'll prevent the cuff from being damaged as well. Now we're still leaving some arthritis inside the joint because we can't do much about that other than smooth out the edges like we did, but hopefully this will give you some relief. Okay, so not as much surgery as you needed on the right side. So good luck to you now. Bye-bye.